So what do you call it when your patient with diabetes refuses to take his medication? You call it insulins. Hi everybody, it's Ryan here again with another informative video in internal medicine. Today we're talking Necrobiosis, lipoidica, diabeticorum. Alrighty, hope you and your family are well. Let's get stuck in, guys. A 45-year-old patient with type 2 diabetes mellitus presents to your rooms with skin lesions on the shins as depicted. Plaque-like erythematous on the shins. What is your differential diagnosis? Is it A, erythema nodosum, B, pyoderma gangrenosum, is it C, pretibial myxedema, D, necrobiosis lipoidica diabeticorum, or E, acanthosis nigricans? I wonder. First up, guys, what is necrobiosis? It is characterized by a plaque-like lesion with a central yellowish area surrounded by a brownish border where on the anterior surface of the leg. It may be shiny atrophic skin, so it lacks hair, with surrounding telangiectasia, or it can be fibrosis with scarring from previous ulceration, which may also be seen. Now, this is somewhat rare, right? Medium rare? No, just rare. Finding in diabetes in under 1%. It may also herald the start of diabetes. It may occur in pre-diabetic patients. Approximately 85% of cases of necrobiosis lipoidica diabeticorum develop or go on to develop overt diabetes mellitus. It is 2 to 3 times more common among females, usually among the young to middle-aged. The cause is largely unknown. We do not know what causes it, but it is postulated to be due to small vessel damage. Here are some examples, courtesy of short cases in clinical medicine. Thank you so much. So we can see a plaque-like lesion, erythematous on the anterior shins with surrounding telangiectasia. Here we see it again. Some fibrosis and scarring here. This is the early necrobiosis lipoidica diabeticorum before it reaches the typical plaque-like erythematous stage. So if you have to biopsy this lesion, what does it show under the microscope, histologically speaking? Well, there's necrosis of collagen, infiltration with our beloved epithelioid cells, and as always, giant cells with glycogen and lipid deposits. What's the differential diagnosis for necrobiosis? Well, necrobiosis xanthogranuloma. Cutaneous sarcoidosis also mimics this, so watch out, right? So sometimes you may have, erythema nodosum with diabeticdermopathy and arthritis in the setting of sarcoidosis, something called Lofgren syndrome. It could be localized scleroderma, which looks like this with skin thickening and fibrosis, and of course, pan polyarthritis nodosa. How does one treat necrobiosis lipoidica diabeticorum? So at the heart of management is better glycemic control. Get that A1C within target, please. Right? Protect that skin and avoid trauma. Dressing as well as local application of topical steroid triamcinolone is a good idea. Sorolin and UVA may offer some benefit. Surgery with skin grafting, especially for cosmesis. Low-dose aspirin, occasionally pentoxiflin may be used, and laser therapy as well. So what is diabetic dermopathy? This is characterized by atrophic round or oval-shaped reddish-brown or pigmented patches in the skin. It's also found in the same region as necrobiosis in the pretibial area. It's precipitated by trauma associated with neuropathy. So initially it may be scaly, but then flattens out and becomes indented. By the way, which is the most musical animal? It's fish, because they got scales. Talking about scaly there. Sorry, just a small joke on the side. So no specific treatment of diabetic dermopathy is necessary. As always, at the heart of it is better glycemic control. So address that HbA1c, bring it within target. What are the skin changes in diabetes? Well, there's a whole host of them. So we spoke about necrobiosis lipoidica. Then there's diabetic dermopathy. You can have ulcer or gangrene, astigmata or peripheral vascular disease, secondary infection in the way of boils, carbuncles, candidiasis, acanthosis nigricans, which speaks specifically to insulin resistance. Right? So you look at your skin folds, you look at the axilla, you look at the nape of the neck. Xantholasmata and eruptive xanthomata, speaking to hyperlipidemia, hypercholesterolemia. Other skin changes, the list goes on. Granuloma annulari, lipoatrophy and lipohypertrophy, which speaks to injection insulin use. Diabetic bullae, Others that keep company, especially in type 1, is vitiligo, which is an autoimmune phenomenon which keeps company with type 1 diabetes. Xanthomata, we mentioned peripheral anhidrosis, and this thing called diabetic rubiosis, which speaks to redness of the face, hands, and feet, is attributed to diabetic microangiopathy. Very important point, everybody. Necrobiosis lipoidica may be found in non-diabetic cases also. Example in rheumatoid arthritis. So here we don't use the term Necrobiosis lipoidica diabeticorum. We just say Necrobiosis lipoidica. So coming back to our clinical case, guys, that skin lesion that we saw is, of course, Necrobiosis lipoidica diabeticorum. Today, I just want to speak a little bit about anxiety. We all face situations in life that are anxiety-provoking. Sometimes we don't know what to do. We don't know who to turn to. It seems so difficult. It seems like an insurmountable problem that faces us. But I just want to encourage you in the book of Philippians chapter 4 verse 6. Paul speaks to the Philippian church and he tells them, listen guys and girls, be anxious for absolutely nothing, but in all things through prayer and petition with much thanksgiving, make your request known unto the Lord. And verse 7 goes on to say, then the peace of God which transcends all human understanding will guard your heart and mind in Christ. In Matthew chapter 6 verse 34, Jesus says, therefore do not worry about tomorrow, for tomorrow will worry about itself. Each day has enough trouble of its own. Commit your plans to God, and He will see you through, my dear brothers and sisters. God bless you with peace in your heart. Have a wonderful day. I'll see you soon with another video on this channel. God bless you.